everybody. It's Andrea Curless, health coach for Tiller-Hewitt Healthcare Strategies. Here today from Friday from the Field, but it's all about making you matter. So, as we all know, February is Heart Health Awareness Month, aka Cardiovascular Disease Awareness Month, or Love Month. So with that, I want to bring you some tips and some do's and don'ts about cardiovascular health. And I'm also going to bring it to you a little bit about the personal side, but also how you can interlace your professional side as well. Well, today I'm actually getting ready to head out. I am headed over to the hospital to go to the Cardiac Rehab Center. It's actually in the hospital, and the exercise part of the center can be used for all employees. So all employees can go ahead and use it just like a regular fitness center. But in the morning, they actually have what they call a startup meeting. And in that startup meeting, all the physicians get together and they actually work with the therapist and the coaches to give them the insights of actually what's going to be happening for that day and also for that week, or if we're getting close to a weekend, for that weekend as well. The protocols in which that the rehab center actually has to do for those inpatients, where they would have to go up onto the floor, or if the actual patient is going to be coming in. Or it could even be for the patients that have been discharged but still coming in for actually rehab. So I love going because I like using the center, and they have a rowing machine, which I love to row, and I don't have a rowing machine. So with that, your quiz is, how many minutes of physical activity when it comes to cardiovascular cardio do you need per week? Yep, you're right. It's 150 minutes is minimum. So if I just divide that out by 5, that's 30 minutes of cardio at moderate intensity. Now remember, last year I told you all about your heart rate. So depending on what your heart's doing, because this is your muscle, and you can't actually lift weights with that muscle, so that means the only way to work it out is actually to do cardio. So I'm going to utilize the center for cardio today, but then I'm also going to attend the startup meeting this morning just to make sure that I'm showing a presence, but also to bring presence, because we know it's Valentine's Day coming soon. So we have our dark chocolate, which is a do. A dark chocolate is a do, a milk chocolate is a don't. And the reason for it is the dark chocolate provides antioxidants. It actually helps rid free radicals. So we want to consume some dark chocolate. We just have to watch how much. So I have nice little dark chocolate little kisses for them. But then I also have dipped strawberries in dark chocolate and dipped cherries. Now, the dipped cherries came about because during this time, strawberries are really, really hard to get. So cherries are not. So you could actually even dip the cherries in them as well. So with cardiovascular disease, we want to make sure that we're consuming the foods that our heart actually needs, but also the foods that which our brain is going to tell the heart what it needs to do. So with that, we want to make sure that we're eating healthy fats. That way it keeps our veins, arteries, and capillaries also cleaned out. So those healthy fats would be such as avocados and salmon, olive oils, coconut oils. Those are some of the healthy fats that I would definitely start incorporating in your diet, but not so much like, let's say, for instance, those animal fats. So we want to reduce some of those. Now, the other thing that I want you to do is that you have to know your numbers. If you don't know your numbers, we know that heart disease is still the #1 killer in both men and women. So, and most of it is undiagnosed because they just don't know what they don't know. So we recommend that you actually take your blood pressure. It's a great time to actually take it when you're in any of the offices, or you can actually take it at the rehab center, or you can go to cath lab, or you can get a piece of equipment here in your own home and actually take it. You want to take it in all different types of areas, meaning that if I'm at work most of the time, then that's where most of my time is spent. So that's probably where my heart's working the most. So I want to take it during work. If I am at home and I have a lot of stress, then I want to make sure that I take it at home to see if I'm making sure that I'm managing that stress with that blood pressure. And remember, it needs to be below 120 and below 80 as now our new norm. So that's the numbers in which that you're shooting for. It's also a great segue when you're actually talking to some of the cardiovascular teams is to say, you know what do you recommend for me based on my age, my lifestyle? What should my number be? And if my number is not in that area, what would you recommend? So it's always a really, really good segue. But remember, it starts with your primary care doctor. So these are the conversations that you should definitely have with your primary care doctor personally, but also professionally when you're actually bringing docs around, is making sure that you know what they need. What kind of information do they need? How do they want the education to come through to their staffs? And the cardiovascular team can help you with that. So The other thing that is a really big driver when it comes to heart disease is stress. And when I was growing up, I remember during February is when we made our Valentine's Day boxes, and we made out all of our Valentines for all of our classmates. And then during the day, we actually exchanged those. So I think that it's so important that when you're dealing with a lot of stress, one way to help relieve stress is through gratitude. So each night I write down 3 things that I am so grateful for from that day. Sometimes throughout the day, I might put them in my notes in my phone so that way I can remember them and do a recall at night. But I think this is also a great time, especially during Love Month and Heart Month, is actually to express your gratitude to all of the team members that support us through cardiovascular care. So make out those little Valentines, or better yet, even have your kids make out Valentines, and then you can take them to the groups, post them around their offices. You know, they are our superheroes. So make sure that they're standing out through our Heart Health Month. So if you ever need any help, please reach out to Tiller-Hewitt Healthcare Strategies. We'd be more than happy to help you. But remember, take care of you by making you matter. I'll see you the next time. Bye-bye, guys.